Call this meeting into session. It is now 6 o'clock on July 14th, 2021. I'd like to call first for the Pledge of Allegiance. Is there anyone that would like to lead us? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And now a reading of the mission statement. Is there anyone that would like to read the mission statement? Thank you, Donna.
Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence.
Thank you. Item 3, adoption of the agenda. Is there a motion to adopt the agenda?
So moved.
Motion by Burke. Support. Support by Lori. All in favor signify by saying aye. Aye. Nays? Motion approved. Item number 4, hearing of the public. This is the time for members of the public to speak on any item that they wish. Is there anyone from the public wishing to speak to this committee? Seeing none, item number 5, request to approve. There's 5A through I. Do we want to go through these one by one? Yes. Okay, 5A, request to approve travel and conference attendance for the PCIT, Parent-Child Interaction Therapy Conference to Orlando, Florida. Is there a motion?
So moved.
Support.
Motion by Donna, support by Megan.
It's my first time. I did want to talk a little bit about PCIT. It's an evidence-based practice. I'm sorry. Michelle Ivy, I'm the program supervisor for the Children's Department at Macomb County CMH. I see some familiar faces that I've known for a long time. Nice to see you. So I am running the Children's Department, and this is one of the programs that we have to service our kids who've dealt with trauma and fetal alcohol syndrome. Typically, that's typically the target group. It's parent-child interaction therapy. It's for kids ages 2 to 7. Typically, you will see a lot of behavioral concerns coming in, a lot of noncompliance, a lot of tantruming, conduct type disorder. The training model is has been around. We've been doing it in Macomb County probably for about 4 or 5 years right now. It's actually an international training. It's done all across the nation. A lot of the trainings in the past have been out of the country, Europe, Asia. There was one, I believe, in Europe as well. This is the first training that's been available, like very close to Michigan, which is why we're submitting the request for approval. The PCIT has shown great, tremendous progress with kids, having less issues at home, positive interactions with their parents, less issues at school, better compliance. The research that's been done, and I believe it's just the one group doing all the research from the international conference. They've shown to be great strides with these families, and these families are actually saying that what they're learning, they're able to use these practices for about 5-year time frame. So there's a lot of payoff with this practice, and the interventions itself typically might only go about 12 months. So it's not like a service that goes on and on. It's get them in. There's 2 phases. At work, we have a 2-way glass mirror and the therapist on the other side, and they actually coach that parent into good feedback, good redirection, positive affirmations. And then in the second phase, the therapist actually bring the child to maybe out in the public, maybe at the home, and they try to practice these real life scenarios in the home. So it goes from, kind of generalizing what they've learned to a place where the child is typically most of the time. So it's a great practice. There's a lot of success here. We have 2 clinicians that practice right now, and like I said, they've been wanting to go to a conference. They've all have been out of the country. So this is the first one that is at least close to us in Florida.
Hi, good afternoon, evening, everybody. My name is Crystal Boweezy, and I'm the Director of Community and Behavioral Health. So I don't think I've met everybody here before, so I want to make sure I introduce myself. I think. So listen.
Thank you. Are there
Any questions or?
Yeah, any questions?
any questions from the board?
Approve. Do you-
Move to approve. Linda, support? We already had a motion.
Oh, for the whole thing, they were all, okay, and we're doing them one by one, okay.
Yeah, one by one. All right, all in favor signify by saying aye. Aye. All opposed? Motion carries. Thank you. Request to approve nominees for Citizens Advisory Council. Is there a motion?
So moved.
I heard a motion and a support. Okay, is there anyone going to speak on this?
Hello, everyone. It's so nice to see all of you in person. I am Lori Valuet. I am the staff support for the Citizens Advisory Council. Tonight, there are 2 candidates that we're bringing to you for approval. James Friedman, who is a captain in the East Point Police Department. He is also a chaplain with the police department and multiple departments throughout the county. He has extensive involvement in the substance abuse community, and he's very interested in helping us to promote access to our services. And we're also recommending Teresa McGarity, who was recommended to us by Commissioner Wallace. Thank you very much. She is the most enthusiastic person I have ever brought to the board for CAC approval. She is involved in a multitude of things in the community. Carmanos Cancer Center, a children's charity in the community, a multitude of things, public safety in the community. She is very connected and is very interested in helping us to try to reach the people who haven't used our services, to help us identify why that might be. They're both extremely motivated individuals, and I'm very excited to have them. It always makes me happy when I get to bring people forward who are very excited to be involved. So that's what I have. That's what I know about them. Unfortunately, we haven't met them in person because of the pandemic, but we've talked to them a couple of times myself. And I also have with me tonight, too shy to come up, is Pat Haver. Pat is our new chair of the Citizens Advisory Council. So Pat is involved with me in interviewing and meeting the folks. So that's what we have.
Thank you. Any questions or comments?
I have a comment, Ryan.
Yes.
But I just think, I don't know that I need to abstain, but I think I should disclose that I have a very close working relationship with Teresa's brother-in-law, so I didn't want to just not vote and not say that.
Yes, Phil?
Thank you, Mr. Chair. I wanted to congratulate our new chairperson. Congratulations. And Lori, assuming these 2 are approved, how many members will we have on the CAC in total?
Well, that's a good question. We will have, assuming these 2 folks are approved, that will bring us up to 7, which is actually technically 1 less than we should have. You will recall that in March of this year, we had 3 members of our CAC leave. 1 because he became a board member, which is great. 1 because they just decided they were ready to retire. And 1 because she moved out of the county and could no longer serve. So I'm still working, or we are still working, on filling those positions. So I hope to come back to you in a couple of months with a couple more people. But since these folks are very enthusiastic and really want to get going, we just wanted to bring them on.
Thank you, Lori. Thank you, Mr. Chair.
Linda?
I just wanted to comment what a good job Lori does and how happy we are to have our new chair also, and glad that you're here tonight. the Citizens Advisory Council is very important to this board and to the work of this agency, and I'm sure to David and all the leaders, because of the information they give us. And then they meet once a month, and David and usually a staff member comes and talks about a program too, gives them a great presentation on what we're doing, and so it's really a kind of two-way communication, and I appreciate all Lori does to capture everything I say in the minutes. I'm the liaison to the CAC from this board. And Lori recruits with the help of people, I understand.
With the help of the council. The whole group actually does it.
Yes, and she's asking us tonight for some more good recommendations. And then she vets them, and then the CAC determines to bring them to us, and then we approve their membership. So I support it.
Thank you.
Thank you, Linda. Any other comments?
I have one other question.
Yes,
Of the 7 members, how many people represent the people that we serve? Is it all 7? Is it a percentage?
Assuming we add these other 2, and now we will have 7, we will then be at 4 of the 7 will be primary or secondary consumers or both. We have 1 long-term member that was a member of the service community. That is to say, she worked, I believe, for DHS for a long time, so she is familiar as a professional with the population that we serve. And then these 2 individuals, neither has disclosed that they are a primary or secondary consumer, so I'm working on the assumption that they are not.
Okay, thank you.
any other questions or comments? I just want to say that I do know of Captain Friedman, and has done some exemplary service throughout Macomb County and to training to our police departments in the county. And I don't know him personally, but I've heard nothing but fantastic things about him. So it's a great addition. So thank you.
Thank you.
We have a motion. We have a second. All in support?
Aye.
All opposed? Motion carries. Thank you. Next item on the agenda is the request to review motion to reconsider recognition payments.
Mr. Chairman?
Motion by Nick?
Well, yeah, you need no, yeah.
Oh, you want to talk? Yes, okay.
We have a motion.
Okay, got it.
Yeah, as the board members, I think, know, we hastily decided to do the $500 recognition payment, but we didn't flesh out the details of the program when the board acted. So that's created some confusion and some consternation in certain quarters. So I've prepared, and you should have received it in mail, basically David's language from the email that he sent earlier today, and I'll just run through it if I could. I move that we recommend to the full board that it reconsider the motion it made for the $500 recognition payment, and substitute and adopt the following motion. The Macomb County Community Mental Health Board approves a one-time $500 recognition payment to all employees that provide services through our agency located within our geographical boundaries, through reimbursement to providers from our agency for the actual costs associated with the $500 payment, as well as employer-related costs that amounts to an estimated cost to the PIHP of $5.6 million, and that's our understanding is that's Medicaid refundable to us. That reimbursement be subject to the following limitations. First, we would to qualify, the limitations on an employee are that they must provide full-time, part-time, or temporary work, provide or support the provisions of the community mental health agencies covered services within Macomb County be employed as the date of the board action, which would be the full board meeting, and be currently employed on the date of payment, that they cannot have received a similar grant from another CMHSP or PIHP. And then the new piece, just to give you an idea, is that they did not benefit from the federal UI Workshare program in 2020, which amounted to $600 a week for about 2 months or so. So they've received more than this benefit already. And that the providers would then be required, in order to participate, to agree to the following for their employees in order for them to receive payment. First, that they have not opted out of the payment by August 16th of 2021, just giving us some time to notify them. That they perform a special payroll run only covering employees that meets the qualifications noted above, no later than August 27th of 2021, that they submit the special payroll run to CMH no later than September 10th, 2021, and that they sign an attestation of compliance with the requirements and a commitment to make the payments to the appropriate employees. Now, you may wonder where those dates came from, and they came from basically Richard, who, in consultation with Dave, figured out how much time it would take to notify and get the notifications back and get things actually done. So I'd move the adoption of that resolution, or amendment.
Okay, motion by Nick, support by Phil. Lori?
Yes, I'm going to be abstaining from this.
Okay. Okay. And again, this is just a motion to take it to full board. This is not a motion to approve.
Well, this is a motion to urge the full board to do this. So
Yes,
to that
okay.
extent, the committee is
Okay.
approved.
All in favor signify by saying aye.
Aye.
Aye. All opposed? Motion passes. Thank you, Nick. Request to sign substance abuse disorder EGRAMS contract amendments. Item 5D.
So moved.
Motion by Megan, support by Chris. Is there any discussion?
Can we have an explanation?
What's that?
Can we have an explanation?
Yep. Is Helen going to speak about it? Okay.
Oh, there we go.
Good evening, Helen Klingert, Director of Substance Use Services. So before you tonight, we have the request for signing EGRAMS. I know Dave speaks often about EGRAMS and our love and joy we have with that wonderful system. So it's a two-part here we have tonight. So we have our standard block grant allocation, which the state gave to us prior to the beginning of the fiscal year. So probably like last September or so for the beginning of the year. But if you recall at that time, once the fiscal year started, the state removed money from the block grant allocation statewide, which resulted in us losing over $1 million in Macomb, and that's because the state had over-allocated. And so we knew that, we adjusted our programming accordingly, but being that they originally put the money in, we had to make all of our work plans in EGRAM line up with that original dollar amount. So now that they've adjusted the dollar amounts and things, now they're giving us an opportunity to adjust our work plans. So for us, it was pretty simple because we did most of ours based on percent of served, not an actual number. So we didn't have too many adjustments to make. They did add an additional $4,000 as our second round of tobacco funding. And so we had our first round of $4,000 we already used this year. At this EGRAMS amendment, they added in the second $4,000 amendment that we'll use by the end of the fiscal year. And that we're using to target messaging as it relates to e-cigarettes and vaping. And so we have a couple projects for that will be going on in our community in partnership with our community coalitions. And so that's reflected in that first round of EGRAM changes. And then in addition to that, we also have the new block grant supplemental COVID funds that the state awarded to us. And so they had let us know that the money was coming in from the state. You've probably heard about that. That's kind of the money that got caught up in the legislature over, are we going to release the money? Aren't we going to release the money? And so at first they released about 17 million of the dollars. And so we received a little over $1 million. You'll see, I think it was, we got $1,115,538 out of that go around. So that actually starts now. And so they put it in eGrams so that they can allocate and release that funds to us. They will turn around in another week or two separately and open up eGrams for the planning for that. So it may be another thing that comes back and needs signed again because they do these all in steps. So the second one for the COVID supplemental is just that we can accept the dollar amounts in eGrams for this new project. So that year runs from, technically, I think it started in March, even though they didn't get all their approval from the federal government, and it'll go 2 years out. So that's in addition to our regular block grant dollars. Any questions?
Any questions? Just curious, has this been, it looks like it's been approved by the county executive and corporation council? Has it? Corp council. Corp council, okay.
Yeah.
Any, all in favor? Aye. All opposed? Motion passes. Thank you.
Thank you.
Item 5E, request to approve National Council MTM Services Agreement / contract. Move to approve. Phil, support. Linda? 5E. Is there anyone to speak on this? Dave?
This one's me.
Okay.
We are paying very close attention to our front door. We are tracking our call center stats. The new customer service department is doing very well in answering the phones. We still have some bottlenecks. So recently I have removed the prior authorization requirement for a number of services. And we're looking at even adding some more. So I started with all the psychiatric services, saying that they did not require a prior auth. If you need to see a psychiatrist, see a psychiatrist. No concerns about overutilization right now, given the state of our county. Spoke to providers. I asked them to please increase the number of appointments in the focus calendar. The response from the providers was, we'd be happy to do that. There's a large no-show rate. So for them to hire staff, put them in those positions, they could be damaged financially. So it was suggested, and we put it in place, where we now pay them for no-shows in order to get those appointments in the calendar. We are looking, and Adam's the point person, to allow the customer service folks acting in their triage role to have somebody go directly to a provider site under certain clinically appropriate conditions, and not having to go through our mental health triage line. So we want to focus our staff in on the critical neediest people. In talking to other people and some of the National Council conferences and things, MTM is a consultant group affiliated with the National Council. What their proposal is, that it was in your packet, lots of attractive things. One, like I said, the reputation is top-notch. But the results of their consultation have been very, very impactful in other places around Michigan that have used them. For same-day access. So they look at how you're currently set up, and then they tell you how to allow the people to get help faster, which is exactly what we're looking for. We have a lot on our plate right now, but if you look at their proposal, they break it down into kind of a la carte sessions, typically about 4 to 6 hours each of staff time. So that was very attractive. This isn't pulling a bunch of staff offline at a time when we're trying to see more people, and we'll be able to manage that schedule and everything. So also, our CCBHC demonstration project starts in October, which includes the mild to moderate, which will truly be no wrong door. So it's a great time for us right now to really look at how people are entering our services, and for us to do that as best as possible.
Thank you, Dave. Any questions? No? Seeing none, we have a motion and a support. All in favor signify by saying aye. Aye. Opposed? Motion passes. Request to approve National Council Case to Care Training. Dave, is this also you?
I don't think so. I'm looking at Adam's looking back at me.
Okay.
And nobody in the, we did this once before. When we started the CCBHC, we used some of the, and this is probably covered under those grant dollars, that we need to move to the integrated healthcare model. So our case managers were very familiar with the community mental health system. A care manager focuses more on the whole person. So again, the National Council, as in their expert roles, they do a great training that helps our staff move to the becoming a care manager and being more familiar and comfortable with writing a integrated healthcare goal, a healthcare goal in general, and things like that. So we're trying to just expand on what we did the first round, and pull more people in and keep this project going.
Any questions? Oh, yes, we need a motion and a support. Thank you.
Support, okay.
All right, motion by Phil, support by Dr. O'Connell. Then I think we have, Phil, did you want to speak? Nope.
Nick?
Nick wanted to speak, okay.
No, I just have a quick question. We're, if I'm reading this right, we're training 2 adult case to care, or 2 sessions for adults and 2 sessions for child. How many people will we be training, do you know approximately?
Adam, do you remember what they did the first round? I think it was smaller groups, like 25 or so.
Yeah, I don't recall the total amount that was done first round.
And I guess the related question is how many do we need to train to, this part of the
everybody.
CCBH?
Yeah, all of them.
Wow.
So we, as new people come in, we'll have a need to do that as well.
But how many of our, this relates to the CCBHC program?
I know the first round was covered by our grant dollars, yes, we put it into the CCBHC budget.
Okay.
Okay.
I will get you the details about who we trained in the first round and who we're projecting to train and the number for the second round.
And the first round was covered by the grant. This
Yeah.
round is being covered by,
I believe it's grant funding still as
Oh,
well.
okay.
We've not exhausted that.
thank you.
Okay, we have a motion and support, and no other questions. All in favor signify by saying aye. Aye. All opposed? Motion passes. Item 5F, request to approve National Council Case to Care Training. Oh, the 5G, the adult virtual training, the 3-day 5G. Is there a motion to approve 5G?
So moved.
Motion by Megan, support by Dr. O'Connell. Anyone going to speak on this?
This
Dave.
one I'm actually more familiar with.
Okay.
We were looking at, as part of the board work group on expenditures and revenue, Dr. Agnes Ward brought this one forward. We do a lot with the mental health first aid and training the community members and stuff. We had not touched on teen mental health first aid, which is what this contract would do. So in our work with the school systems and stuff, we're looking to be able to expand the teen mental health first aid. I think I presented to the board before, the CDC did a study last year that over 25% of the children surveyed said they had actively considered suicide in the prior 30 days. The pandemic, the impact on children was much more significant than on the adult side. So the timing of this is good, and it goes with our outreach efforts to our other community partners.
Dave, was that the teen contract
mental
or
health
the
person.
adult? Do we have, there's both.
Oh, I'm sorry, I did H. Yeah, it's the, I'm skipping ahead.
That's okay.
They're both mental health first aid.
Who does the teens work with the school districts? Are we working with the MISD then?
Yes.
Oh, okay. And are there, Megan?
I'm sorry. You can finish.
No, go ahead.
I was just going to ask, if you've been certified in mental health first aid, is it 3 years or 4 years you have to renew?
I don't know.
I think I want to say it's 3, sounds right? Okay. But to recertify or to renew, do you just have to take the course again?
Yeah, and, yeah, we do have trainers. So this would be, yeah, the adult is for mental health first aid. Up to 16 community partners will be identified on the adult side. And then the children's teen mental health.
Knocked out 2 of them.
Okay, yes, we did.
I think we're doing yeah. I think part of that was train the trainers in the school system so that they would be able to grow that internally as well.
Okay. Any questions on either the adult portion of this or the teen portion? Donna? No? Oh, okay, I thought I saw, okay. All right, well, thank you, Dave. I know you talked about H. Do we want a motion to pass both of those?
I'll amend, well, I guess I didn't make the motion.
Okay.
Can I amend it?
Well, we'll just take them one at a time. So motion to approve H, all in favor?
Aye.
All opposed? Motion passes. Motion to pass H, request to approve the National Council 3-day teen virtual training contract. Is there a motion? Motion by Nick, support by Lori. All in favor? Aye. All opposed? Motion passes. Item I, request to approve MDHHS PIHP 2021 Amendment Number 2. Is there a motion? Motion by Linda. Support by Donna. Is there anyone that's going to speak on this?
No.
No, okay.
It came up unexpectedly. There's no change in the dollar amount. They did add some additional and modified some of the attachments. I still need to, it's on my schedule for tomorrow morning, to review it more in-depth. So I'll provide a written summary update to the board ahead of the full board meeting.
Okay, thank you, Dave. Any questions? No questions? All in favor signify by saying aye.
Aye.
All opposed? Motion passes. Item 6, receive and file. 6A, contract boilerplate, SUD FYS 2223. I read that funny. What's that? Those are years, yeah, okay. Is there a motion to approve? Support, our Dr. O'Connell, is there support?
Support.
Support by Megan. Any discussion on this one?
I won't make Helen get back up, but Helen worked very hard and made updates and changes to the boilerplate for all of the substance use providers under contract with this body. She worked with Aaron Thomas, so all of those things were approved. I've reviewed it, and because of the timing of because of our need to get it out to the provider system in time for them to review and sign, we put it in for receive and file for this evening. We would like to put it on as an approval action item at the full board. So that'll give you all time to review it as well, and happy to answer any questions between now and the full board meeting.
Okay. Any questions? A motion to put this on the full board meeting. All in favor signify by saying aye. Aye. All opposed? Motion passes. Item 6B, contract boilerplates, specialty service contract, fiscal years 2022 to 2023. Was that's better?
That's why I asked.
Yeah. A motion to approve?
So moved. Support.
Motion by Dana, support by Megan. Is this the same thing?
Yeah, Christina Mozella was working on this one. Christina's not feeling really well. But yeah, put a lot of, been working on this for quite some time, reviewing the changes at the state level, recommended changes. Again, working closely with Aaron Thomas from Corporation Counsel. I've reviewed it at least twice now, I think. And again, it was just approved by Corporation Counsel yesterday or late the night before. And due to the timing and the need to get it out, again, we would like it to be receive and file for today's meeting, give you the opportunity to review it before the full board, but that it be an action item at the full board meeting for approval.
Okay. Nick?
Yeah, I don't have any problems with moving these on to full board. This committee has now seen them at least. We haven't had a chance to fully digest them, and I'm sure that's true of others. But there is one question on the specialty service contract ones that you may or may not be able to answer, and I understand if you can't, and because I haven't read it yet fully. And that is whether or not what we've done in terms of progressive discipline if there's a violation of the contract, as opposed to just a breach of contract and pulling out, at which point we leave all sorts of recipients in the lurch.
Yeah, I don't know that exactly. And actually, the copy of the contract that you have, Christina and I were going back and forth. So I do have a cleaner version. I left some of the border comments that identified some of the areas that were still impossible question. But I will clarify those, get you an updated version, and respond to the progressive discipline issue.
Thank you.
After today's meeting.
Phil?
Thank you, Mr. Chair. I just want to thank Sandy and Dave. We've been working through a process for items like these that come up at the last minute. I know Nick and I have expressed concerns for a while now about the timeliness of getting these in front of us, and I just thought for now, receive and file might be the best way, because at least we're seeing them ahead of time and we have some time to act on it at a later date, and it's not, we're getting it the day before and we have to read through all these documents and decide. So if you have any other ideas as to how we can move forward, I appreciate any input, but I appreciate Dave and Sandy working with me on this to get this on the agenda for us in some way, shape, or form so that we can act as quickly as possible. Thank you, Mr. Chair.
Thank you. All in favor signify by saying aye.
Aye.
All opposed? Motion passes. Item 7, a resolution of someone that's dedicated 25 and a half years of service, Dan Burke. Is there a motion? Motion by Donna and support by Nick. Is there anyone that is going to speak on this? Okay.
I just wanted to say I worked with Dan. We were hired about 2 months apart, and I worked with him for almost the entire 25 and a half years. We were co-workers, and he eventually ended up being my supervisor. And he was a wonderful co-worker and a wonderful supervisor, and I enjoyed every minute of working with him. and I wish him all the luck. I was hoping he'd be here today, because I enjoyed him. As a matter of fact, I called him the dancer. We went to a wedding of one of our coworkers, and he was a great dancer. And so I always referred to him as the dancer after that. And I hope that we'll stay in touch after he leaves CMH. So I'm going to wish him and Colleen, his wife was a deputy at the Sheriff's Department, and I'm wishing him all the luck in the world. So I was hoping he'd be here today so I could give him a big hug. Thank you.
Yeah, thank you.
And I can just tell you,
Oh, okay.
he's not here, but they're having a retirement party, so we can share that information with you. It's at a restaurant, it's coming up, I apologize, I don't recall the exact date, but I can forward that to then be shared.
Thank you. All right, there's a motion and support. Thank you, Donna. There's a motion and support. All in favor signify by saying aye.
Aye.
All opposed? Motion passes. Item number 8, other agenda items, a compliance overview. Probably a motion to receive and file would be in order. Okay. Motion and support. All yours, Ms. Coleman.
Okay, did it do it? Good evening, everybody. This is the first time I'm presenting to you in person. I think all these have been by Zoom.
It's
since
been a
I
year, yeah.
Came to the agency, so it's nice to see you all in person. Sorry, my pets are missing, like they used to always join the other meetings, but I'll make this relatively brief. I know that your time is precious. We're just going to give a little bit of an overview about our staffing. We're going to talk a little bit about the staffing and compliance. Wait, it's not going forward. Wait, sorry. I'm sorry. About our compliance staffing, the compliance activities are due process staffing. Those are the folks that handle, well, folks, it's Lori and myself, that handle the Medicaid fair hearings as well as the local appeals and the activities that we've had this past year and quarter. So quickly, for the core functions of compliance, those come straight from the Office of the Inspector General's office. These functions are the things that we're required to do. These are identified. I didn't want to give you 50 slides, so I'm going to talk very briefly about each one of these. I am our Chief Compliance Officer. We have a compliance assistant, that's Madison Ferlicki. We've introduced her in the past. Previously, we had a compliance administrator. She resigned on the 21st of May. We have 2 open positions technically in compliance. We have the compliance administrator and another compliance coordinator. I'm not seeking to fill those positions at the moment as a result of the lower number of cases that we have coming in. It doesn't seem prudent to do that at this point in time. So when we look at our core functions, our first function is to implement policies and procedures and standards of conduct. We have updated all of our policies and also our compliance plan for the year. We do have a compliance committee. We meet quarterly to go over the cases and any trends we're seeing associated with compliance. We've updated our trainings to reflect any changes in the Code of Federal Regulations and Medicaid standards. We're also offering face-to-face trainings to different departments of the agency if people want to talk about something related to compliance or if we're seeing a compliance trend. When we first went remote, there was a big issue with privacy. How do people now, in the middle of their living rooms, keep our protected health information separate? How do they make sure that their children are not overhearing? What do they have to do? So we met with different divisions and different departments to talk to them about some of the safeguards they needed to take. When we look at effective communication, we are always open for business. We made sure all those phones were forwarded. We do a lot of emails. We updated so that it's not just that people can use the email system for compliance reporting, but they can ask a question. And we've started collecting frequently asked questions so that we can publish those out. A lot of the questions are the same, but we want to make ourselves very available to our internal staff and our external providers so that if they have a compliance question, is this a compliance issue, they can ask that question instead of just simply reporting it. We also have developed a compliance corner, and we put that in the Good to Know newsletters that come out monthly. We also use Dave's CEO updates to put out compliance issues. We've issued a couple of compliance memos, the thou shall not do types of things. We prefer to communicate with people proactively, though, to say that there's a change coming with the Code of Federal Regulations, there's a change coming in Medicaid. These are the things we need to do. We also spend a lot of time in meetings with the provider network, the provider monitoring, and with quality with all of those providers, making ourselves very available to them. And we've started integrating ourselves into with the SUD providers. They were an area that wasn't necessarily very integrated into compliance, that we didn't attend their meetings in the past, and we are doing that now. When we talk about provider monitoring, guidelines and audits, we do our audits as we engage in case reviews. We also, all providers submit to us a quarterly OIG report, so they tell us any activities that they've had related to compliance. We're required to report out to the OIG quarterly. Unfortunately, the behavioral health folks from the OIG left the office in November, and they didn't backfill that spot. So we have submitted 3 quarters worth of OIG reports. They're just now reviewing those reports. They had told us in August of last year that they were going to amend the OIG report. Instead of 30 pages of directions, it would be 130, and that it would be much more complicated, and so we would have to make those corrections and provide training to the provider network, but they haven't done that yet. So far, with Madison Verlicki's help, we have gotten an A on our first 2 quarters, so we just had to change a couple of lines, but we got a pass. You're only allowed to submit those 3 times, and then you have a corrective action plan. So we're really happy to submit this huge file to the FTP server and have it come back with, oh, one of your lines was a little wonky. We provide disciplinary guidelines for offenses in the event that cases are substantiated. We work with the chief of staff and providers on individualized cases. A lot of these relate to external providers. Our ask is them to identify what you have done to prevent recurrence of this. Okay, if there's an incident of fraud, waste, or abuse, or privacy violation, what is it your agency has done? And we don't necessarily want it just to be that one person. It may be an agency-wide issue. So for example, if it's privacy, what protective actions have they taken? We also do, we detect offenses and we implement corrective actions. We do the investigations and monitor those remedial actions. We have some providers, the SUD providers, for example, will catch their cases immediately. They start investigating them immediately. I would rather the people with boots on the ground look at those and then provide us part of their investigation so we can work through the rest of the pieces. We have a large SUD provider that their compliance person just kind of up and left, and the new person said, wow, I've got this fraud case, what do I do with it? So we walked them through the process. We gave them our format and our template for how we do our investigations. With regard to our cases, in 2021, we've had 12 cases come in. 10 of those are closed. 2 of them came in this week. We're trying to do a 2-week turnaround on cases. When I came into the agency, there were hundreds. There were hundreds of cases backlogged, but they weren't necessarily fraud, waste, abuse, or privacy. They took something called concerns. They took a lot of things that didn't necessarily relate to corporate compliance. They took anything that was a concern and made it an open case. We will consult with anybody on a concern they have. We will refer it to the appropriate department, but if it's not fraud, waste, abuse, or privacy, for having us log hundreds of cases that won't get to in years. We are cleaning up the backlog. We finally cleaned up 2018 and I believe 2019. We have 1 case left, but there were literally 280 cases when I walked in the door here in November of 2019 that were backlogged from the year before. So we're doing a great job returning those around. Of those 12 cases, probably the most concerning thing is 3 of those went to the OIG for fraud. We have to report out for fraud. That's a pretty high number to have go to the fraud. I spent 3 years at another region and didn't have more than 2 go up to the OIG for fraud, but these were pretty blatant cases. Take-backs, so when you take back, that means you've substantiated fraud or waste. We've taken back $2,009.60 to date of these cases. When we go to our due process team, many of you may remember, grievances used to be under our department, and Mark Galati, who handles our grievances as our ombuds person, moved to the customer services department earlier this month. Lori Valué is our local appeals coordinator. We have updated the due process policy to make it reflective of the state contract. Our previous policy wasn't consistent with the state contract related to the Code of Federal Regulations. So our policy is now we're developing procedures so that anybody can see the procedure that we engage in when we have a local appeal. Lori is also overseeing the HSCB at this point in time. And as I said, Anwar went to customer services. I looked at the Medicaid Fair Hearings. I handle our Medicaid Fair Hearings. We've had 14 requests. Of those 14 requests, 5 were withdrawn, 2 of those cases were upheld, meaning the Michigan Department of Health and Human Services, Michigan Office of Administrative Hearing and Rules upheld our decision. 3 cases were dismissed, meaning the judges indicated there was no jurisdiction in those matters. 3 were overturned. I would indicate that the overturns in each one of those cases was that the judge said we had to reassess the person. So the judge didn't say we made a bad decision. They indicated that we had to reassess. 1 case is pending that I have next week. This is a historically low number. As a general rule, they were averaging around 76 cases a year, so we've only had 14 for the entire year. I'm not sure what all of that's about. We think it may be because people were given more services and supports as a result of COVID, and Dave took off some of those authorization requirements, so we're not seeing the cases. For local appeals for the year, there's been 77 requests, and 9 were withdrawn, 6 were partial approvals, 13 were overturned, 1 is pending, and 48 of those cases were upheld. Primary trend with those, a lot of those cases are for personal care and a specialized residential. We have a lot of folks asking for specialized residential, and we simply don't have, they don't meet the criteria for personal care and a specialized residential, but are seeking residential placements. We're also running into an issue with inpatient hospitalization for children. We don't control that list. There's a wait list, and the state has decided they will take people off the wait list, and that basically they won't even notify the people. They then require the people to go through what Michigan Disability Rights is calling a hamster wheel. Okay, then you reassess them, then you put them back in the wait list, then you reassess them, then you put them back in the wait list. So this has been a long-standing thing with Hawthorne Center, our primary case. Local appeals are down too. At this time last year, there had been 107 by this time. So the numbers are much lower relative to Medicaid for hearings and local appeals. I expected when I took on hearings that there'd be many more than that, and there just really haven't been. Of those cases that came to Medicaid for hearing, though, 5 of them were the same case. So it was a repeat thing that kept coming back. Some key takeaways: compliance continues to take an active role in regional service provision. Local appeals have decreased over the year. Our ombudsperson moved to customer services on 7/6, and Medicaid fair hearings have decreased over the year. You will see upcoming that you had approved last year for me to attend a conference, and then COVID hit. You approved the travel and everything, and COVID hit. We got all of our money back for the travel. They did not reimburse for the conference. They've now started to reschedule those, so you look forward to receiving a request to actually attend the conference when everybody gets vaccinated. So, any questions?
Thank you.
Mm-hmm.
All in favor of the receive and file? Aye. Okay. Motion passes. Discussion, I guess we don't need a motion for these things. A discussion on the legislative breakfast. Oh, that's the printout about, okay. Is there anyone? Nick?
Yeah, the Legislative Policy Committee met, a couple of weeks ago, and got a great deal done in my absence, since I had eaten something that obviously did not agree with my system, and was unable to attend that morning. So I want to thank Linda for the excellent job of chairing it as our vice chair. Essentially, the meeting was to discuss our reactions and how to proceed with our reaction to the 2 major redesign systems that are being introduced in the legislature. The Wyford proposal, which was introduced about a month ago and has had some hearings, but is being held until at least the fall for any action from from what Representative Wyford has indicated, and Senator Shirkey's proposal, which we have seen drafts of, but we expect will be introduced tomorrow. So we haven't seen the version of the bill as it's presented. The committee decided that we should do 2 things. One is that we should hold a meeting with the Macomb delegation to the legislature and invite the county exec and the county commissioners and the CAC to discuss our concerns about those proposals, but rather than just saying no, as members of this committee know, the commission know, we have gone through about 4 or 5 years now of one proposal after another being presented to allegedly reform us, but mostly we think would be pretty destructive to what we've already got going. But rather than just say no again, the feeling is that we should be providing the legislators with alternatives, because just saying no suggests that we're doing everything right, and they don't believe that. And quite frankly, we know that there are areas that could be improved, and we've been doing a lot of improvement. So the proposal was to have this meeting so that Dave and the committee members the commission members could bring the decision makers up to date on all of the improvements that are being made and what other improvements we think should be made, as well as to bring to their attention the problems with the bills that are before the legislature. The Shirky bill has some pretty serious problems. The Whiteford bill has a number of serious problems, but actually has some good points as well. So we could have a discussion with the legislators on the good and the bad. To do that, we're hoping to put together a breakfast, or I think it was a breakfast, right? A breakfast with the legislators sometime, hopefully before or shortly after they return to session in the fall. David is putting together a work group to do the planning and to put together the logistics. The staff has already begun working on a fact sheet for distribution. To that end, I've asked Mark and Linda to join me with Dave on working on a work group that'll include staff people to essentially pull that together so that it actually comes into place. So I don't know that we need to take any action now. That's simply a report for the commissioners to let them know what the committee's decisions were and what our next steps are. And Linda, did I miss anything other than the meeting? So, okay, thank you.
Well, the dates that we're considering.
Oh, yeah, I didn't bring the dates.
There's a packet, everybody has a packet.
Okay, it's in the back.
Who wants to talk? I don't see, oh, Phil.
No, I didn't hit the button.
Oh.
I'm testing you.
Okay.
So, yes, there's a printout in front of us. Sandy worked pretty hard on getting some room availability and dates put together. We had discussed at the meeting, and they're in front of us right now. So I'm thinking the sooner we decide this, the better for a date for Sandy's purposes for booking the room. So if we could decide on a date tonight, that would be extremely helpful. And then Sandy can book it, and then we can work out the details with Nick and the committee. So if anybody has a preference, I don't mean to take this away from the chair, but we'll turn it over to him now, and he can.
Okay. I do have a question. I don't know if there's anyone else that is scheduled to speak. Has legal looked at this in terms of us spending money on food and to speak to legislators? I do know of, there's some law about not giving gifts. I know this isn't a gift. This is a educational piece, but has this been reviewed at all?
Yeah, there is a maximum amount you can give without reporting for like food and accommodations, and it's fairly, I don't remember the exact number, but we aren't going to spend that much money.
Okay.
So,
I know, I mean, it's bagels and coffee, I understand, but
that's right.
Okay. Is there someone that could look at that, just to trust but verify?
Sure.
Okay. Okay, thank you. Megan?
Just a suggestion, but I don't know why I feel like August is not that far away, but I feel like it isn't.
Because it isn't.
I would say, I mean, it looks like both offerings have Monday, August 16th. I don't know if you have to make like a motion or anything, but I almost think the further out the better. It gives people more time to plan. So I would suggest the 16th.
I agree. Thumbs up. Fab.
Was there a reason why you wanted this note later than the 16th?
Yeah, the 16th I can't do, but I do think the other two dates are too early. Can we?
Phil, didn't you have a reason why you wanted it not after the 16th?
Well, I think when we started planning it, we started a little bit earlier, but I mean, they go back into session in September. So we honestly have probably the whole month of August if we wanted to, but I know we were just looking to get it done.
Yeah,
relatively soon.
I would urge,
You're not available the 16th?
no, I have a Civil Service Commission meeting in Lansing that day.
I don't know if I'll even be available that day, but I just still say for booking purposes and for push out purposes, you pick.
Okay. Well, we don't need a firm date today. This will be decided at the next meeting. Is that right?
Yeah.
No,
We need a book.
the date.
Okay.
Well, we need to book.
Yeah, okay.
Sandy, is the
Yes.
23rd
Yeah,
and
okay.
30th?
Yes, Donna.
So are these dates available, Sandy?
Yes.
So August 9th, these dates are available with
Yes,
these two
this
venues?
is what each facility has open currently. Now, if we want to change it, we had said we wanted a Monday or a Friday. I can check the 23rd, the 27th, and the 30th, if you want me to check those dates.
No, I don't think we want to start doing that, but these dates are available now.
Whatever's listed, yes.
Okay.
They have dates available by each one of them.
So August 9th is available if we wanted to go with August.
Whichever location, yes, that
Okay.
you would want. You have to pick the venue also. I'm not picking that,
So,
that's you.
so is everybody, I'm just wondering if everybody
August
is
ninth.
Just the
available on
messenger.
August
Yeah.
August 9th is
You
the
know,
executive board
trying
meeting
to get
for
a
CMH,
consensus.
if you were thinking of Alan or Bob being there, but.
The 9th?
Is
Okay.
everybody available on August 9th is just what I'm kind of wondering if that date works with everybody, but,
Yeah, the 9th,
Better.
is, I'm available any of the dates except for the 23rd, but I'm worried about whether we're going to get it put together.
Is there a preference for the location? I need to know that.
What are the, okay.
Yeah,
Nick's
two
Italian, I
choices.
bet he's going to go with the Italian-American.
I mean,
I-
we could still
well-
do the 9th. That's
Okay, I just need the
almost a month
location.
out still.
Do you want me to send
Almost.
out an email tomorrow and you guys can let me know so you can look over the pricing and what's offered? I just want to get this done as soon as possible.
I think, we could cloak just someone with authority to make an executive decision on the date and the venue, and that way, we just move forward on that.
Her name is Sandy.
Someone like Dave.
Okay.
Yeah,
It's your call. I mean, you have Macomb County Community College. We have to have catering brought in. They do not have the resources at this time. Or you can do the Italian American Cultural Society. Dave has been there for an event and said it was a nice place.
Why did we rule out 15 miles?
15-mile what?
And
During
if-
the meeting, that was a consideration to have a caterer in our office on 15 miles.
Given the time constraints, this is easier for us to work with and establish.
yeah. Mr. Chairman?
Yes, Nick.
If I could, I just saw this piece now for the first time, so that's probably problematic, and I kind of figured the work group was going to be working on that. I'm glad Sandy's done such a great job at checking things out. I'm a little worried about whether August 9th is only 3 weeks out, whether that's.
Well,
gonna
that's
give
why I
us-
called early, to see if they have the availability.
Right, And we don't know whether either of these venues is available?
No, they are available. Those dates are available.
Oh, I understand, but
Yes.
the later dates in August, we don't know.
The ones that I said, like the 23rd, the 27th, no, because I was only told we didn't want to go past the 16th. So
Oh,
that's why I
okay.
didn't ask
Okay.
for other dates.
Okay, and the care would have to be catered, obviously. but-
If you go to Macomb, if you go to the Italian Cultural Center, it's all included there.
No, but the committee had talked about, as Linda indicated.
Oh, that would have to been
Using
catered
our
to.
center on 15 Mile Road, which obviously would
Right.
also have to be catered.
Right.
Yeah, I appreciate Phil's desire to make the decision and get it over with, because I agree with him. But I think we need to get the work group to review some of this.
Yeah, who's on the work group, Nick?
The work group is me, Mark, and Linda, and then Dave is bringing a number of the staff folks who will probably end up doing the bulk of the work anyway. And I don't know, he can tell you who from the staff will be following.
What about
I
if
assume
it-
Sandy will be.
Nick, and I guess this is open to the entire board, what if we cloaked somebody simply with authority to make an executive decision on this, and then, we as a board don't make a decision, we authorize somebody to make a decision on the date and the venue and so forth?
Yeah, I mean, I don't have a problem with authorizing.
Who wants to make that decision?
I don't have a problem with authorizing Dave to make that decision, because I know.
All right, there we go.
I know he'll do it in consultation with the rest of us anyways, because
All right.
it doesn't do us a lot of good to hold this
Right.
unless people are going to be able
So
to make it.
I think we could entertain, how about a motion, something like move to direct the CEO to book one of these two venues at the price and amount that he sees fit as presented. How about something like that?
Is there a budget?
The budget is the number.
No, those are what the price are. I
Yeah,
wanna know-
not to exceed a certain amount, and of course, subject to legal review. Yeah, so it's a motion to direct the CEO to choose the venue and the amount, subject to legal review. Is there someone that would like to make that motion? I do have to abstain from this due to a conflict.
Support.
All right, motion from Lori, or Donna, and support from Nick. All in favor signify by saying aye. Aye. Motion carries.
Dave doesn't
doesn't
get to
get a
vote,
vote.
otherwise it wouldn't be unanimous.
All right. CEO update. Well, you're back in.
Okay. A couple of updates. Rachel Gade started as our new Director of Clinical Informatics. She started on Monday, and very happy to have her with us. As we move forward, data is vital, but showing the outcomes of the good work that we're doing, and she's working closely with Adam. Stacy's working on one of our 90-day projects specific to data, so she's working with her. She's getting to learn. Stacy, you commented, you gave her the list of all of our acronyms and stuff, so she's off to a good start. Also starting is Kathleen Kozlowski as our new Director of Communications. So she'll be working with Jasmine Watts, who's currently in place, and Jasmine will be helping us with the legislative breakfast and stuff. Also need to give credit to Dr. Agnes Ward. I attended her integrated health care work group because she oversees all of those activities in her department. There's a lot of really good work going on. And I told that group about our legislative breakfast, and I asked them to please bring forward some information to help us with our planning. We will be putting together an informational packet for the participants of that event. So we've started those activities already. I had a meeting this morning with the Office of the County Executive. following which they did approve our contracts for the general ledger software package and the HR payroll. So now the work begins in both of those areas. A lot of details, things to work out still, but that was a very good move to allow us to move forward in those areas, working closely with the Office of the County Exec, the finance and HR departments, of course. We've also, the lease was approved to the 19800 Hall Road address. So thank you for that. It's officially signed, and we are starting the planning in that area. Big thank you to Tracy and TJ, who are doing a lot of work on that one. We have a certification process coming up for our CCBHC demonstration project, which is under the state of Michigan. So we did a certification last year for the federal government. We have to do it now specific to the state of Michigan. So our work group is working on that document right now as well. There's a lot of meetings going on right now between the state of Michigan and the 14 agencies and counties and agencies that are working for the CCBHC demonstration project that starts in October. So it was just like a side job now. Conferences, Linda, I did heard from Linda. I had reached out to staff, so I wanted to thank the board for their support and approval of the out-of-state travel. Stacy mentioned her training as well. We are encouraging our staff to take advantage of appropriate trainings, things that allow them to get certified in special areas and stuff now too, as another good use of our supports at this time. We do have a residential, I'll say it's a crisis. We have providers now. The pandemic has gone on a long time. Again, I can't say enough good things about our provider system. They've managed this pandemic extremely well. The staffing issues are the core issue right now. Staff have worn out, staff are burned out, staff are leaving for other opportunities, and there's some homes now that simply cannot continue to function. We are tracking it. We have 8 homes that are on our watch list currently, and we're talking about worst case scenario, because we retain, ultimate responsibility for the care and welfare of those individuals. We can find locations for them, but finding the staff people who are trained and able to support them is a challenge. The state of Michigan is very aware of this. They say they're working on it, which is great, but there's nothing to put in place right now, and we're starting to experience some issues. We are reaching out now to the providers on the TBI side. If anybody saw the Cranes article about the Eisenhower Center, the Michigan's no-fault changes did impact the residential providers for the traumatic brain injury folks in a very negative way. It was a significant, sudden, like 45 to 65% rate cut. So a number of them are laying staff off, closing down homes, and putting people out into the community suddenly, which has to be very difficult on the people involved, their families. So the Eisenhower Center that was highlighted in the article, we actually contract with them. So we're going to see, hey, if you have staff, you have facilities, we might be in need of those as part of our crisis backup plans. So it's very much an issue across the state. We are planning as best we can. And again, just can't praise our provider system enough for managing their way. They're doing it right now, and we'll be doing it all night, things like that. So, but it is a growing concern. Again, thank you for the clarification on the recognition payment. I will be sending a written update to the Board of Commissioners tomorrow morning to reflect what was discussed now, letting them know that it will go to our full board for approval. Oh, and then the long thing that I was supposed to talk about. You all approved the RFP for a consultant group for our accreditation under NCQA. We did get those proposals back. It came down to two primary respondents. The one who scored the highest is the Mahalik Group, and we do have their proposal. They will be sending a contract, a letter of engagement forward, which will go through the legal corp counsel process and then our board review. I just wanted to give you a heads up that the Mahalik Group had been selected. Did this go in the packet? So in your packet, you have the details from their proposal, and it's very much in line. Adam and Sandy and I all worked with them previously, and went through the whole process, and we were accredited with a score of 96.3. So they are a well-known national consultant group for this process. They will do the initial readiness assessment. We will score very bad. Just know that going in. Right, Amy? Amy's spearheading these efforts for us, so she'll be very up close and personal with the consultant group. It's also, I think when it first came up, I said it'll be a chunk of money. So I've been trying to give you a heads up all along, so hopefully when you see that it's a chunk of money, there's no big shock and surprise. But it's a 3-year proposed. They'll give us an idea about where we are, how long it'll take us to get to where we need to be. From the time you submit your application, they look back 6 months from that date. So you pretty much have to work really hard, get all your ducks in a row, run it really well for 6 months, then do the submission, and then they'll come in and the NCQA will come in and tell you whether or not you become accredited. So we will be working with them. We will be bringing the contract formally forward through the board and corp counsel and office of the county exec process. Happy to answer any questions, and Amy's more than happy to answer any questions. Amy would love to come up to the podium and talk. Amy's been, like I said, spearheading this through our quality department, so nice to see you in person, Amy.
You too. I spoke to you all, I believe, in February and introduced you guys to NCQA and the wonderful process that we're embarking on. It's very exciting, and I've been working with Brianna, our policy administrator, a lot, and we've been reviewing a lot of our policies, and we are, I'd say, quite deficient as we're approaching NCQA. So when they do the readiness assessment, it will not be a surprise that we need to beef up our policies, increase our procedures, our workflows, but everything will get us to where we want to be and streamline everything and make sure that we're the best at what we do. And that's the goal. And that's why we need your support so we can move forward with this. Does anybody have any questions on the RFP or the process or the proposal?
Any questions from anyone? I have one question. Why are we going to score bad?
Okay, so honestly, and I would say poorly, not necessarily bad. It's different of perspective, but a lot of our policies have not been updated since 2002, 2008. We're working in a backward process, I think, where things were just kind of, okay, this is how we do it. We're going to move forward with it, and things haven't really changed the way that we need them to with technology, with evidence-based practices, so on and so forth. So a lot of these, like I've been working on a few policies where I basically said, need to scrap it and start fresh. Let's see what we're actually doing, put it in policy so we can actually follow it and move forward. So that's kind of where we're at right now.
Okay.
Is that a fair assessment?
It does go beyond the policy. Policies are very important. You have to have very clear written descriptions, but they're going to be looking at the decision-making process for our reviews and authorizations, how that's documented and tracked and reported. They're going to be looking at outcome measures based on the HEDIS measures, which are what the health departments use, which again goes to our integrated health care. And a lot of it is the monitoring, measurement, tracking, and the interventions and taking actions on those in those areas to demonstrate improvement. So it's very much in line with our future, where we need to go. We're not there yet. We know where we need to be.
We know how to get
and it
there.
won't be a surprise. The reason we're going to score poorly is because we simply have not been operating underneath an NCQA mindset. We've been operating under CARF, and this is a different set of eyes coming in. So that first round, that readiness assessment, they're going to come in and use the NCQA survey basically and survey us and go, this is how you would have scored. No surprise, it will be less than, 75%. But then with their help and consultation and Amy's assistance and lots of other staff's assistance, we will dramatically improve that and pass with flying colors.
And they will give us the recommendations of how to get to where we want to go.
Yeah. They can pretty much tell you how you will score before you do your submission, is the way they work. And have a very successful track record, so.
Thank you. Megan?
Amy, I just wanted to thumbs up you for taking that on. I totally know how hard that can be, but it sounds like you guys have like the absolute right mindset. It's hard to get out of like survival mode of, we've kind of always done it that way. Let's just work with what we have. So I just applaud you and your whole team. So good job,
Thank
guys.
you. Thank you. It's been a wonderful experience building the team and
Sure.
getting everybody on board to say, this is where we want to be. Let's work together to get there.
That's the most important too. That's the hardest part.
Yes.
So.
Thank you, Amy. Any questions for Dave? Donna?
I just wanted to, I know when I was an employee in CMH, which wasn't really that long ago, we had a manual about this thick of policies. Is that what you're talking about? I mean, how many policies are we talking about here? If that's what we're talking about, then, it's a
Yeah,
really,
it's-
I mean,
I've never seen them
my
all in one
hat's
spot.
off to
but
you. Is that, how many policies are we talking about?
Over 200, but it's over 1,167 pages of policy.
Yeah, so that's the manual I'm talking about, yes. Because I know once in a while, when someone would do something, someone would say, go check the policy. And that's when you'd like, oh, no, because there's a lot of policies, so.
We're working hard to make sure everything that's written reflects current practice
Yeah.
and that it's accessible to the people who need it
Yeah.
when they need it, which is our website primarily, the intranet and things like that. But yeah, it's all together. Thank you, Amy. I did not know the number of policies or the pages. That's going to haunt my dreams now.
My hat's off to you, Amy.
Yeah. But yeah, it's a large undertaking, and that is a foundational piece for the accreditation. But you need to say that, I'm going to do this within 48 hours, this within 72 hours, and then you need to show that clearly. So you need to have all those tracking and reporting mechanisms in place. We'll get there.
Any other questions for Dave? Dave, I have one question. I don't want to tie up the board. You said there's a crisis, a residential crisis, caused in part by burnout, maybe that labor shortage.
It's basically
The
staff
pandemic staff shortage. There's many causes for it. And that there are people whom we serve that might no longer have a home. Did I understand that right?
Yes.
Okay, that's a serious thing. We know the problem. What are some possible solutions? What can the board do to help, if anything?
We might have to bring, since Phil touched on it already, some expedited contracts or agreements or special arrangements. We've had some internal discussions and have gotten fairly creative and are working with finance about how could we fund alternate settings, really looking at any setting that would have staff in place to ensure the health and safety of these people as a last-ditch effort emergency thing. The state has an emergency staffing system where they're using, I believe they were staff contracted through the correctional system. But the feedback on the provider side is when they go to trigger that system, it's no. And if they do, it's kind of a shift here and there. In my meetings with the state, they've shared that the state of Oregon had to have the National Guard come in and staff their adult foster care homes. So, it doesn't provide any comfort to know that we're not alone because, like I said, we're responsible for these individuals. So we're very open to feedback. One suggestion was that we came up with internally. There's occasionally we have a provider who's in a licensed setting. They no longer have the staff. We have another staffing provider who would be able to go into that home, but the license needs to be transferred into that new provider's name so that they can bill and everything works. That goes through the Licensing and Regulatory Affairs Office in Michigan, and there's delays there. So I reached out to the state, the Behavioral Health and Developmental Disabilities Administration, and I said, hey, here's one practical thing. If you could expedite and allow for faster transition of those licenses, that would help. And they said, thank you, that they understood that, but that's another department, and there's difficulties there. So, we're on record as that's one tangible option. And then, like I said, we are reaching out now to the TBI facilities about their staff, about their facilities, about their availability to help us support people. So we might be bringing forward some fairly interesting, creative contracting opportunities so that we can ensure the health and safety of these folks. It's bad. There's no way to, and no desire to sugarcoat that.
Any follow-up questions on that? Is there, can we subcontract through somebody? CBO, or can we bring in people from the Eisenhower Center that were laid off and,
We're talking to them specifically, yeah. And then other TBI facilities. The problem is the staff are not available across the board.
Yeah.
So we have physical plants. We have places that people could go, but then it's trying to staff them. And you can't just grab, anybody, and you wouldn't want to. We need staff that are trained and monitored, or things can go wrong real quick. So yeah, we're trying to do some planning and to be as creative as we can.
Thank
So
you, Dave.
Wide open to ideas.
Can you keep us informed?
Yes.
And maybe we could lean on the legislators when we meet with them at breakfast on.
Yeah,
on
like
this.
it is on the state is working on it, the state's aware of it, but, and then I do a monthly provider stability report to the state. They do ask in there which providers, the number of providers who have closed up due to the pandemic. So we'll be keeping them updated as well about what's going on here in Macomb, that these people are at risk, these people have closed, so they'll be well aware.
Thank you. No other comments. Item number 9, a hearing of the public. This is the time for the public to speak. Is there anyone from the public wishing to speak to this board? Hearing none. Item 10, adjournment. Is there a motion to adjourn? What's that?
I had to request to speak
Oh. Oh, there it is. I'm sorry.
I just want to remind everybody that there was a recipient right to the advisory meeting next Thursday, the 22nd, at the admin building, at 8 a.m. And that's all I want to say.
Okay. Thank you, Lori.
It's in person.
Is there anyone else looking to speak? No? All right, item 10, a motion to adjourn is in order. Motion by Nick, support by everybody, by Megan. All in favor signify by saying aye. Aye. All opposed? Motion carries. We are adjourned.